Hi, my name is Amy Kiskaddon, and I'm a pharmacist at JohnsHopkinsAllChildren'sHospital in the Heart Institute. I'm also assistant professor of pediatrics in the Johns Hopkins University School of Medicine. And I'm going to share a little bit about our project that I presented at the World Congress of Pediatric Cardiology and Congenital Heart Surgery in August of 2023 on the use of ketorolac in neonates following congenital heart surgery. And to provide a little bit of background on this, I have strong interest in research, sedation, analgesia, thrombosis, and one of our intensivists, Dr. Arabella Stock, has similar interest in pain management, sedation, and delirium following cardiac surgery. And when we met a few years ago, our interest in this particular topic led us to develop a pathway specifically looking at the use of non-opioid agents in our patients down to neonates following congenital heart surgery, and this included ketorolac. There is some concern with using ketorolac given concerns of bleeding and renal impairment in the neonatal population, but in developing our institutional-approved algorithm, we decided to make certain criteria that would allow the neonates to actually get it. And so after a couple of years of using it, we decided to retrospectively look at our data, and we had about 40 patients total who had received ketorolac, who are specifically neonates following congenital heart surgery, at a dose of 0.5 milligrams per kilo every 6 hours for up to 48 hours. And with regards to renal impairment, per the KDIGO guidelines, we actually didn't observe any clinically or statistically significant rates of renal impairment, and we didn't see any major bleeding that would be according to the ISTH criteria or by the criteria published by Nealis and colleagues. And then with regard to opioid administration, while we didn't have an actual group of patients to compare them to since this was a single center retrospective cohort study, we did compare our opioid requirements for these patients to what's been published in the literature, and we actually found that there was pretty low rates of opioid administration in the patients who had acetaminophen and ketorolac. This is actually good because we're trying to look for ways to minimize opioid exposure in this patient population due to the long-term outcomes that are potentially negative. So we're very excited about these findings, and we're looking forward to future opportunities with research and ways of looking at the data to come up with ways that we can help provide optimum care to our patients who are undergoing congenital heart surgery. Thank you.